Hello, Professor. My name is Sergio Gonzalez Rodriguez. Here is my SCF ID. And then this is my audience. Every day, millions of Americans face a harrowing choice: pay for a life-saving medication or pay their monthly rent. We live in a nation that leads the world in medical innovations, pioneering robotic surgeries and groundbreaking gene therapies. And yet, the United States remains one of the few developed nations where a medical emergency can lead to total financial ruin. We have the best technology, but some of the most restricted access. This isn't just a political talking point, it's a fundamental necessity. At some point, everyone in this room will require medical attention, whether it's a routine checkup, an unexpected broken bone, or a chronic diagnosis. The healthcare system will eventually touch your life. Understanding how a universal system functions provides insight into a more secure and fulfilling life for you and your family. It's about moving from a culture of coverage to a culture of care. By the end of my speech today, I want you to agree that the United States should implement a universal healthcare system. Such a shift will create a vital safety net for our most vulnerable populations, generate long-term economic benefits for our nation, and restore public trust by finally protecting healthcare as a basic human right. Firstly, a universal system provides a critical safety net for those currently suffering in silence. In our current landscape, millions of uninsured or underinsured Americans delay treatment for chronic conditions because they are terrified of the bill. The delay isn't just a financial strategy, but can often lead to a death sentence. According to an NPR study, about 1 in 7 people with debt said they've been denied access to a hospital, doctor, or other provider because of unpaid bills, according to the poll. An even greater share, about 2/3, have put off care for themselves or a family member because of cost. According to a study by the National Institute of Health, the implementation of a universal system could save over 68,000 lives and 0.73 million life years every single year. Research consistently shows that a lack of insurance correlates with higher mortality rates and late-stage diagnosis. The NIH study, Universal Healthcare in the United States of America, A Healthy Debate, notes that this system addresses the epidemic level of non-communicable chronic diseases such as cardiovascular disease, type 2 diabetes, and obesity. These conditions currently strain our economy and our morgues. By mitigating these health disparities between different socioeconomic segments, we don't just help the poor, but also help stabilize the entire nation. Furthermore, universal coverage ensures that mental health and preventative services are accessible to all, ensuring that wellness isn't just a luxury reserved for those who can afford the high costs. Beyond the morality of implementing a universal healthcare system would be a massive economic boom to the United States. One multi-payer system involves staggering overhead costs spent on billing, marketing, and insurance negotiations. The NIH estimates that a single-payer universal system would likely lead to a 13% savings in national healthcare expenditure. This is equivalent to $450 billion annually. The study suggests that the entire system could be funded with less financial outlay than what is currently paid by employers and households through premiums and existing government allocations. We are already spending the money, we're just spending it on paperwork instead of actual patients. Beyond administrative waste, the universal system boosts labor productivity and entrepreneurship. Currently, many Americans stay in job lock, staying in positions they dislike or overqualified for simply because they are afraid of losing their health benefits. According to Harvard Ministerial Program, a high disease burden leads to absenteeism and high turnover, which erodes productivity. With a healthy, educated workforce, it is more efficient, increasing total productivity across all sectors. Finally, universal healthcare promotes public trust and protects the right to care without financial hardship. Transitioning to this model signals that our government prioritizes the life and dignity of its citizens over corporate profit. The U.S. is a global outlier in medical bankruptcies. Even those with insurance are not safe. Consider the Foy family of Virginia, who, despite having insurance that was government-backed, ended up owing over $775,000 after a medical crisis. They were forced to file for bankruptcy. Furthermore, even small debts have made citizens feel betrayed by the government, trying to protect their interests in having equal access to healthcare. For example, the story of Eddie Adams, a 31-year-old medical student from Texas who was pursued by debt collectors for years for a medical exam she received after she was sexually assaulted, despite Illinois' law prohibiting victims to be billed for these types of exams. Universal systems protect patients from financial toxicity. Furthermore, a centralized system increases transparency. It allows the public to hold the government accountable for the quality and equity of care provided. It moves healthcare out of the shadows of private boardrooms and in the light of public service. In conclusion, we have seen how a universal system acts as a life-saving safety net for our most vulnerable neighbors. We've explored how it stabilizes our economy by reducing administrative waste, supporting a more mobile, productive workforce. And perhaps most importantly, we have discussed how it restores the bond of trust between the state and the citizen by guaranteeing healthcare as a basic right. The evidence is clear, as I presented today. A universal healthcare system is a logical, economic, and moral path forward for the United States. Rather than viewing healthcare as a luxury for few, we must demand a system that offers convenience, freedom from debt, and the opportunity for every American to live a healthy life. It's time to stop treating healthcare as a product for sale and start treating it as a sacred promise. Thank you for your time.